Hello, everyone, and welcome back to COVID Conversations with Elder Options. Today, we are so happy to have with us Dr. TJ Grainger-Rousseau of Hitchcock's Pharmacy, not only Hitchcock's Pharmacy, but of Meridian Behavioral Health. He's also the on-call pharmacist for PsyMed. He has extensive backgrounds in pharmacies throughout the community in North Central Florida. He has been acting as assistant professor at the University of Florida College of Pharmacy, a graduate of the University of Zimbabwe, Masters of Science at Queen's University of Belfast, Northern Ireland, a PhD in Queen's University of Belfast, Northern Ireland. I could go on and on and on with his academic and professional accolades, but we are so happy to have Dr. Timothy John Grainger-Rousseau with us this morning. Dr. Grainger-Rousseau, welcome.
Thank you, Lisa. It's great to be here and to answer some of the questions that you'd like to put out about COVID, which I think is a very real and obviously ongoing issue with our communities.
It certainly is. We are constantly being asked about vaccines and really now about boosters in the community. And what we've done is we have sort of collected our most asked questions and we sent them over to Dr. Grainger-Rousseau ahead of time. And we wanted to share the questions and the responses with everybody listening in or watching today. The first question most people ask is, hey, if the vaccines are working, why do we need boosters? Why is a booster shot necessary?
Yeah, and that's certainly a question that I get at my pharmacies in Newbury and Alachua all the time. We'll go on to our slide over here, and what I can show you is that this is a study that was published in New England Journal of Medicine. Just kind of gives you oversight. It was actually done in North Carolina with about 10 million individuals. It's not a small study, it's certainly a very large study, so we can get some good sense of what's happening here. And in this slide, we see the 3 vaccines that are available in the United States and the effectiveness of the vaccines reducing the risk of hospitalization and death from COVID. The first vaccine is the Moderna, which is in the sort of brown line. And you can see after the first dose, the effectiveness starts at around 95% after the second dose and wanes down to about 80%. On hospitalizations, the efficacy remains above 90%, so it's still pretty effective. And in terms of effectiveness about preventing death, that moved from about 98 to 95%. So you can see there is certainly a reduction in the different vaccines. The Pfizer-BioNTech is the purple line, and the J&J and Janssen vaccine is the lower line over here. So this is Moderna, Pfizer, and J&J. So as we can see, as we're moving out to about 7 or 8 months over here, you can see the drop in the efficacy in all of these lines. So this is where we were getting the emergence of the Delta variant, and certainly with the Omicron that was recently the variant of concern. There was this noticeable drop in the efficacy in the vaccines. And so any vaccine is not 100% effective. And so you will need to get at some point some breakthrough infections, and therefore it was deemed necessary to actually do the booster doses for these vaccines.